Hey, everybody, welcome back. This lesson is about stroke as seen in CT imaging of the brain. We'll start with a general definition. A stroke refers to a sudden interruption in the blood flow to the brain, resulting in neurological deficits. For our purposes, strokes can be divided into two pathological mechanisms. There are ischemic strokes, which account for about 87% of all strokes. There are also hemorrhagic strokes, which account for about 13% of all strokes. Both ischemic strokes and hemorrhagic strokes can be demonstrated in CT imaging. We'll start with ischemic strokes. Ischemic stroke is a sudden episode of neurological deficits caused by a focal disruption in blood flow to the brain as a result of embolism, thrombosis, or dissection. In other words, an ischemic stroke is caused when a blood vessel in the brain is blocked, and that area of the brain is not receiving oxygenated blood. That blockage can be caused by several mechanisms. An embolism is a blockage caused by some material that traveled into the artery. Thrombosis refers to the formation of a blood clot within the artery, and dissection refers to a tear in the wall of the vessel that interferes with blood flow. So what does this look like? We can't always see the blockage itself, but we can see the effect. In non-contrast CT imaging, an acute ischemic stroke presents as a hypodense or dark area within the brain matter. That's what's happening in this patient. The patient was brought to the emergency department with a sudden onset of left-sided weakness. CT imaging of the brain demonstrates a large area of infarction, that's tissue death, in the territory of the right middle cerebral artery. Ischemia refers to the lack of blood flow, and infarction refers to the resulting tissue death. That's what we see on this image. This is the classic appearance of an acute ischemic stroke, a region of hypodensity within the brain matter. We can see this on another patient. This patient was brought to the emergency department with sudden aphasia, that is, difficulty speaking. Non-contrast CT imaging of the brain demonstrates two large regions of ischemia in the territory of the left middle cerebral artery. This condition is described as an ischemic stroke. There is something blocking the middle cerebral artery on the left side. It could be an embolism, a thrombosis, or a dissection. That has to be determined by further imaging and testing. Here's another example on a different patient. This patient was presented to the emergency department with a sudden onset of right-sided weakness, a common symptom of stroke. Non-contrast CT imaging demonstrates the typical appearance of an ischemic stroke. There's a large area of hypodensity in the territory of the left middle cerebral artery. In fact, we can see the left middle cerebral artery in this image. It's abnormal. It's demonstrating what's called the hyperdense MCA sign. It's abnormally bright, which represents a hyperacute thrombus. We can't always see the thrombus on a non-contrast scan, but we can in this patient, and it indicates stroke. The without contrast scan was immediately followed by a CT angiography of the circle of Willis. The CTA study on the right confirms occlusion of the left middle cerebral artery. In the area where we should see a brightly enhanced middle cerebral artery, there's nothing there. There's no enhancement because a thrombus is blocking blood flow through the vessel. The second type of stroke observed in CT is hemorrhagic stroke. Hemorrhagic stroke is a sudden episode of neurological deficits caused by focal disruption of blood flow to the brain as a result of intracerebral bleeding. Unlike ischemic stroke, the blood vessel is not blocked. Instead, it has burst open and is dumping outside of the blood vessel. As a result, that nutrient-rich oxygenated blood is no longer being supplied into that region of the brain. That's what results in the neurological deficits. So the cause of hemorrhagic stroke is very different, and the appearance is also very different. In non-contrast CT imaging, hemorrhagic stroke presents as a hyperdense or bright area within the brain tissue, often surrounded by hypodense edema. That's what we see in this patient. The right side of the cerebrum has a very large collection of blood. The process of bleeding is called a hemorrhage, and the collection collection of blood itself is called a hematoma. Notice that this hematoma is large enough it's causing a midline shift. The brain matter on the right side is swelling and crossing onto the left side of the cranium. We can see the same hemorrhagic stroke in the sagittal plane. The hematoma is quite large. It's also surrounded by a region of edema. That's fluid accumulation that appears relatively dark compared to healthy brain matter. So remember these two types of stroke. Ischemic stroke is a sudden episode of neurological deficits caused by a focal disruption in blood flow to the brain, which is caused by embolism, thrombosis, or dissection. A blood vessel is being blocked. An acute ischemic stroke presents as a hypodense or dark area within the brain matter. Hemorrhagic stroke is a sudden episode of neurological deficits caused by a focal disruption of blood flow to the brain, but for a different reason. It's as a result of intracerebral bleeding. Hemorrhagic stroke presents as a hyperdense or bright area within the brain matter. Thanks for watching. That's been a review of the two types of stroke that we can observe in CT imaging.